This conference will now be recorded.
Okay, you're welcome to start.
Thank you so much. It's 1:01 p.m. and the board is out of executive session. I'd like to make a motion, please, to appoint an ad hoc committee to assess the performance of our executive director. And that committee would consist of myself, Dr. Bechtel, Dr. Rothermel, and Dr. Safran. Is there a... Thank you, Dr. Johnson. Is there a second?
Second.
Thank you so much. I think that was Dr. Safran. Dr. Sohn, thank you so much. Is there any discussion about that? Okay. A roll call then, please. Dr. Rothermel?
Yes.
Dr. Safran?
Should I vote for myself or abstain?
You can vote for yourself, I think.
Yes.
Mr. Jacquelone?
Yes.
Dr. Sohn?
Yes.
Dr. Johnson?
Yes.
Dr. Caccarella? Sorry, that's a yes? Yes. Mr. Ganadakis?
Yes.
Ms. Montgomery?
Yes.
Dr. Feivel?
Yes.
Dr. Bechtel?
Yes.
And myself, Michael Schottenstein, yes. Thank you all. Do I hear a motion to ratify the proposed permanent surrender with SSMD? Motion?
Move.
Mr. Jacquelone and
Second, Dr. Johnson.
Dr. Johnson, thank you. Roll call, please. Dr. Rothermel?
Abstain.
Dr. Safran?
Abstain.
Mr. Jacquelone?
Yes.
Dr. Sohn?
Yes.
Dr. Johnson?
Yes.
Dr. Caccarella?
Yes.
Mr. Ganadakis?
Yes.
Ms. Montgomery?
Yes.
Dr. Feivel?
Yes.
Dr. Bechtel?
Abstain.
And myself, Michael Schottenstein, yes. Do I hear a motion to ratify the proposed permanent surrender with JRC-LMT? Motion?
So moved, Dr. Johnson.
Thank you.
Second.
Dr. Bechtel, thank you so much. Roll call, please. Dr. Rothermel?
Abstain.
Dr. Safran?
Abstain.
Mr. Jacquelone?
Yes.
Dr. Sohn?
Yes.
Dr. Johnson?
Yes.
Dr. Caccarella?
Yes.
Mr. Ganadakis?
Yes.
Ms. Montgomery?
Yes.
Dr. Feivel?
Yes.
Dr. Bechtel?
Yes.
And myself, Michael Schottenstein, yes. Do I hear a motion to ratify the proposed consent agreement with JMFMD? Motion?
So moved.
Dr. Caccarella, and is there a second?
Second.
Dr. Bechtel, thank you. Roll call, please. Dr. Rothermel?
Abstain.
Dr. Safran?
Abstain.
Mr. Jacquelone?
No.
Dr. Sohn?
No.
Dr. Johnson?
No.
Dr. Caccarella?
No.
Mr. Ganadakis?
No.
Ms. Montgomery?
No.
Dr. Feivel?
No.
Dr. Bechtel?
No.
And myself, Michael Schottenstein, no. Ms. Marshall, Chief Enforcement Attorney, will now present the proposed citations to the board. Rebecca, hi.
Dr. Schottenstein, members of the board, we have 6 proposed citations for you this afternoon. You will see there is a theme this month. These are almost all federal convictions. One note, we do normally wait until final sentencing occurs to bring these to you, but the courts are quite backed up right now because of COVID-19. So you will see we included in most of these sites that final sentencing is still pending. Presumably by the time you get to the hearing, hopefully that will have occurred and we'll be able to give you more information. So site number 1 is to be issued to a DO. It's a federal conviction for conspiracy to commit healthcare fraud. Site number 2 is to be issued to an MD, also conspiracy to commit healthcare fraud. Site number 3, same, to be issued to an MD, conspiracy to commit healthcare fraud. Citation number 4 is to be issued to an MD. This physician has been suspended since September of 2018 under a consent agreement. And this is related to his plea of 14 counts of illegal distribution of controlled substances. Final sentencing also pending here. Citation number 5 is for a conviction, conspiracy to commit healthcare fraud, as is citation number 6. Thank you.
Thank you so much. We will be considering citation numbers 4, 5, and 6 separately, so Dr. Bechtel may abstain or vote appropriately. Would any board member like to consider a citation separately? Okay. Do I hear a motion to approve?
Michael, are we allowed to discuss these or not?
I suppose we can. Sure.
Yeah,
Okay.
I think you can. I think I would refrain from using the name until you
I will.
have approved it.
Yeah.
It will
So
become public once it's approved.
I believe it's citations 2. Let me see real quick. Let me just double check that that's the one. Citation 2, I just have a question about. This occurred in 2017, where this doctor pled guilty, and we're just getting the citation now. And I realize that person hasn't been sentenced yet, but I think it's important that once somebody pleads guilty, that we clearly don't wait for sentencing if it's going to take 3 years. So I think that needs to come to us quicker. The citation number 4, I believe should be a summary suspension, and I realize the doctor is already suspended, but technically the board could reinstate that member, and by statute this should be a summary suspension. So I think the site should probably say that this is a summary suspension since you're already suspended. Something along those lines. I don't know exactly how to word it, but I believe that should be a summary suspension. And I realize that, again, they're already suspended, but by statute we have to summary suspend them. So I think the site should say something about summary suspension in it.
Okay,
So
thank you.
part of that broke up, but I'll try to respond to what I heard. Normally in the federal system, their guilty plea is not accepted until the time of sentencing. So and it's different in different federal courts. So if the federal court has accepted their plea, we can act. If they have not accepted their plea, sometimes they've just done a plea to agree to plead guilty and you can't go forward yet. As far as the issue of the summary suspension, you really can't summarily suspend somebody who's already suspended because you don't have any risk of harm to patients if somebody isn't practicing. So that probably factors in some of these situations. Does that answer your question? Because I didn't hear everything you said.
Yeah, it answers my question. I guess I understood that, and I hear what you're saying, but by statute we have to summarily suspend him or her. And I know I'm probably nuanced in this, but I think the citation should say you are summarily suspended, and something along the lines of you are already suspended, therefore, some acknowledgement that this is a summary suspension by statute. I don't know. To me, it just would seem like that should be in the citation.
So are you talking about a summary suspension or an immediate citation? Because those are different.
And whatever is required by statute.
So the immediate suspension can be required by statute in certain circumstances. But again, if someone's already suspended, you can't or wouldn't immediately suspend them because they're already suspended. So there isn't an active license to suspend.
Based on past discussions we've had, I thought that there is an immediate suspension for a drug charge, and given that it's required by statute, I think we should put that in the citation. Personally, unless everyone else disagrees, I don't know. I think we should make it very clear that we're following the statute for this person. Yeah,
I hear what you're saying. You have to have an active license to suspend. to do an immediate suspension. So if you don't have an active license, there isn't a mechanism for you to suspend the license that's already suspended.
So Rebecca, maybe if I may clarify, when this licensee was originally suspended, was it immediate?
So you're talking about citation number 4?
Yeah.
No, when they were suspended originally in September of 2018, it was under a consent agreement. But
Okay.
someone's license being suspended is still suspended.
Sure.
But by statute, it's required to be suspended, is it not?
But if it's already suspended, then there's nothing
No,
to
I mean,
suspend.
you did a consent agreement, but wouldn't it have been required to statutorily, following up on Dr. Feibel's question?
The consent agreement in this case was not related to this conviction. It was related to something else. Does that help?
Yeah.
It does, actually.
Okay.
Thank you so much.
Okay.
Oh, Ms. Montgomery.
For the 3 co-defendants in the Michigan healthcare fraud cases, has the Michigan board medical board taken any action on their licenses?
I don't know that, but if they would have and it was significant or separate from this, we would have rolled that in. But if it's just that board acting on this conviction, then we would probably just cite them on the conviction. But I don't know for sure if Michigan has acted or not. They may not have because, again, most people wait for the sentencing to be final. We're kind of pushing the envelope a little bit on this just because I have no idea when the courts are going to start sentencing people again, and we didn't want to just be sitting on them.
Yeah, and I was just asking because it was an easier case to make if you end up having to go to court. So,
Correct.
forgive me.
Yeah. Okay.
Thank you, Rebecca. Okay. So any other questions or any other discussion? Okay. So do I hear a motion to approve and issue citations 1 through 3? Motion?
So moved.
Dr. Bechtel, thank you. And a second, Ms. Montgomery, I think I saw. Roll call, please. Dr. Rothenbell,
Abstain.
Dr. Safran,
Abstain.
Mr. Jackalone,
Yes.
Dr. Sohn,
Yes.
Dr. Johnson,
Yes.
Dr. Cacarella,
Yes.
Mr. Ganadakis,
Yes.
Ms. Montgomery,
Yes.
Dr. Feibel,
Yes.
Dr. Bechtel,
Yes.
and myself, Michael Shattenstein, yes. Do I hear a motion to approve and issue citations 4 through 6? Motion?
So moved, Dr. Cacarella.
Thank you. Is there a second? Second, please. Ms. Montgomery, thank you. Roll call, please. Dr. Rothenbell,
Abstain.
Dr. Safran,
Abstain.
Mr. Jackalone,
Yes.
Dr. Sohn,
Yes.
Dr. Johnson,
Yes.
Dr. Cacarella,
Yes.
Mr. Ganadakis,
Yes.
Ms. Montgomery,
Yes.
Dr. Feibel,
Yes.
Dr. Bechtel,
Abstain.
and myself, Michael Shattenstein, yes. Thank you. Ms. Stephanie Luca, Executive Director, will now present the operations report. Stephanie?
Thank you, Dr. Schottenstein. For your operations report today, not a lot of new information for you. We'll be talking a little more detail with the report out from the Finance Committee with respect to the medical board's budget requests for fiscal years 22 and 23. And that budget request includes some staffing increases for that next biennium. So we'll be hearing more about that in just a little bit. As of right now, we don't have any active hiring going on. We do have some vacancies that we are going to try to pursue filling throughout the remainder of this fiscal year that are within our current ceiling and appropriation. So no added cost there for filling those vacancies. From a licensure standpoint, we are still missing quite a few licensees renewing, given the tolling that was offered through the pandemic. However, given that 90 days or December 1st timeline was offered, we now know that those licensees will need to renew by December 1st. So we did send a targeted communication out this past Friday to licensees who had their license, who would have had to renew during the pandemic, but were extended until December 1st, who have not yet reviewed. So we're going to increase those targeted communications, just we don't want that to fall off of anyone's radar and have them unlicensed. Their renewal date then, after their December 1st renewal, their renewal date then reverts back to what their renewal should have been, right? So for example, if somebody should have renewed June 1st of 2020, then they don't renew until December 1st of 2020, they still have to renew June 1st of 2022. So that does not change our cycle permanently for those licensees. And we'll need to do some education with them to make sure that they really understand that. I fear that we're going to be chasing some licensees for a few years based on just kind of on the weird dates. So we need to stay ahead of that, and we are aware of that. Most of our community adapted well, and we appreciate that, to us not being in the office. However, going forward, we are looking at something like a virtual call center, and really starting to just kind of explore that and see what cost looks like for that, so that we could actually have licensees taking and receiving calls from home, our licensing staff. So we're looking into that, but email is working for right now. It's not ideal, but it is working, and we are getting a good response from our licensees. So we're very appreciative of that. We've continued to provide the open complaints and closed complaints data to you in the operations report, and we do a month-by-month sort of comparison on that bar graph. We did close quite a few complaints in July. We're down a little bit in August from what we closed from July. However, I do think we're making good progress in this calendar year in given what's coming on with open complaints versus what we're closing. But as you can see, we take in many more complaints every month than we do close. And so that's by nature of some of those complaints really don't take much time, but others do. And so we just need to make sure that we're keeping our eye on the ball on timelines and staffing and addressing those, so that in the event, in the unfortunate event that discipline is necessary, we're timing that discipline or enforcement activity to actually have merit relative to the violation. What we don't want to see is that an action happening and then us not taking action for years, because then at that point we're saying, for the sake of why are we taking action, right? So we'd rather work with our licensees in a more timely basis. So we're keeping some metrics on that and watching our cases and trying to use our system a little bit better to stay on top of those things. So that's all I have for operations.
Thank you so much, Stephanie. Ms. Anderson will now discuss rules and policies. Kim, hi.
Thank you. First, you have a number of PA rules and respiratory care rules that are ready for final adoption. And the public hearing was held on July 23rd. Comments were received regarding the respiratory care rules, but the change was made at an earlier stage of the rule review process. So we didn't need to make any changes after the public hearing. Action ended on August 23rd. The JCAR meeting was August 17th, and there were no comments received. The board previously reviewed the hearing report from the hearing examiner and all the materials at the board meeting on August 12th. So JCAR jurisdiction has expired and the rules are ready for official adoption today. And they're also attached for your review. And if you move to adopt the rules today, we will make them effective September 30th of 2020, which is our normal practice.
Thank you so much. Do I hear a motion to adopt, amend, and rescind the rules as described in the August 27th, 2020 memorandum from Ms. Anderson, and to assign each rule action the effective date of September 30th, 2020? Motion?
So moved.
Thank you, Dr. Bechtel, and I think Dr. Safran. Thank you. Roll call, please. Dr. Rothermel,
Yes.
Dr. Safran,
Yes.
Mr. Giacalone,
Yes.
Dr. Soen,
Yes.
Dr. Johnson,
Yes.
Dr. Caccarella, Dr. Caccarella?
Yes.
There we go, back up. Mr. Ganadakis,
Yes.
Ms. Montgomery,
Yes.
Dr. Feibel,
Yes.
Dr. Bechtel,
Yes.
and myself, Michael Schottenstein, yes. Thank you. Kim, did you want to talk about the formal actions on the medical board website, please?
Yes. So, so we're providing you with a draft protocol to address situations where a licensee, where the discipline against the licensee was either dismissed, so the site was dismissed by the board, or the matter was vacated by the court. And there wasn't another matter that, there wasn't other discipline, there's not other previous discipline. The only discipline has either been dismissed, so it's totally gone, or vacated, so it's totally gone. So we had a question from an individual asking that the indication on the board's website be changed from yes to no in that fact situation. And we thought we should address it holistically rather than deal with individual requests. So that's why we wanted to bring this protocol to the board for a review. And just so you know, if you haven't looked things up on the website, that yes serves as an active link that you can link on, and a dialog box comes up that explains what the formal action is, and then it gives you an ability to hit view, and you can go to the actual formal action documents. So those have always all been on there. So if a matter was vacated, it would show that in the description and in the materials that we had. And so we're mindful that the website does work as a way for our public records to be available. So what we're doing here with this is we're changing that yes answer to a no, but then we will have a notation that if anyone wants the public records, they can get those. Like I think the dialog box will still come up, but you won't be able to get the records. So we're putting instructions that if anybody wants them, they can make a public records request to legal. But that way, in those really rare circumstances, it will show formal action no, because it's technically more true. So that's what this protocol does. So it still, makes the public records available. It's just in a slightly different way. And it indicates no formal action for that licensee. And so if the board approves it, we will be searching our records to find those individuals and make the changes on the website.
Thank you so much. Is there discussion? Okay, I think it's fair. I support it. Any discussion? Okay, motion then, please, to adopt the draft protocol.
So moved.
Dr. Safran, and I saw Dr. Caparolla's hand go up. Thank you. Roll call, please. Dr. Rothermel,
Yes.
Dr. Safran,
Yes.
Mr. Giacalone,
Yes.
Dr. Soen,
Yes.
Dr. Johnson.
Yes.
Thank you. Dr. Caccarella. Okay, well, that was a yes. Mr. Ganadakis,
Yes.
Ms. Montgomery,
Yes.
Dr. Feibel,
Yes.
Dr. Bechtel,
Yes.
and myself, Michael Schottenstein, yes. Next on the agenda is an appointment to the Committee on Prescriptive Governance. I don't know if Jill, you wanted to talk about it, or if you'd like me to go ahead and talk about it.
I can talk about it if you want me to, Dr. Schottenstein. Thank you. There was an appointment that needed to be made to the Committee on Prescriptive Governance. It's a nursing board committee. And we got in touch with the Ohio Academy of Family Physicians, and that's who has to make the appointment. And they recommended that we appoint Dr. Sevilla, and Dr. Sevilla is in private practice at the Family Practice Center. He's on the board of directors for the Salem Regional Medical Center, and he's also an associate professor at Northeast Ohio Medical University. And he's an MD, and he is the president of the Ohio Academy of Family Physicians.
Okay, thanks very much. Is there any discussion? Okay, could we have a motion then, please, to approve Dr. Sevilla to the Nursing Board's Committee on Prescriptive Governance? I saw Ms. Montgomery and Dr. Carcarella. Thank you so much. Roll call, please. Dr. Rothermel?
Yes.
Dr. Saffron?
Yes.
Mr. Giacalone?
Yes.
Dr. Sohn?
Yes.
Dr. Johnson?
Yes.
Dr. Carcarella? That was a yes. Thank you. Mr. Donadopoulos?
Yes.
Ms. Montgomery?
Yes.
Dr. Feibel?
Yes.
Dr. Bechtel?
Yes.
And myself, Michael Schottenstein, yes. Thank you. We'll turn to committees now, please. Dr. Feibel, if you'd be so kind as to provide an update from last month's Telehealth Committee meeting, please.
Thank you, Dr. Schottenstein. The Telehealth Committee met last week after the board meeting. As we all know, the bill was passed by the House in June. The Senate has not assigned it to a committee yet. It will likely be assigned either the Health and Human Services Committee or the Insurance Committee. We grouped our amendments into 4 separate areas: initial visits, consistency and standard of care, the board rulemaking authority, and synchronous technology. As far as initial visit, the exception, not the rule, should be documented. The initial visit should be the exception, not the rule, and this should be documented in the medical record as the reason for the telehealth visit. If at all possible, the first visit should be in person, and this includes a different doctor for different problems within the same practice. We changed the language after much discussion from endangering. Originally, they said if it endangers the health of a patient, you could use telehealth. We recommended changing that to the telehealth visit would be necessary to avoid significant compromise in patient care, or the healthcare professional determines that the patient's health condition requires telehealth services, and a telehealth visit does not violate the standard of care. As far as consistencies in standard of care, the committee had wanted to preserve the standard of care consistency between in-person visits and telehealth visits, but also wanted an exception for the current COVID-19 emergency. So in the current COVID-19 emergency, we want a liberal use of the ability to use telehealth liberally, and we acknowledge that the standard of care may not be as good. But if you're going to use telehealth in a non-COVID emergency, we felt the standard of care exception should not be in there, and you should be held to the same standard of care as an in-person visit. With regard to rulemaking authority, we removed the word fully from informed consent. It previously said that the patient had to be fully informed, and we changed that. And then with regard to synchronous technology, we said you need synchronous technology except in the following situations. The visit is strictly for a verbal consult or verbal counseling as allowed by CPT billing codes, and the standard of care does not require a physical examination. Number 2, the individual has tried in good faith to contact the provider via synchronous technology and something has gone wrong with the equipment. And 3, the patient does not have access to the necessary equipment. The changes discussed at the last meeting were drafted and will be brought back to the committee this afternoon after the board meeting. And we'll have further discussion at that time. Please come if interested. We'd love as many people to come as possible. Any questions? If not, that concludes my report. Thank you.
Thank you so much, Dr. Feibel. So now I'll provide an update from last month's Compliance Committee. So the Compliance Committee met on August 12th, 2020. The substance of the meeting had to do with OPHP concerns regarding the establishment of a reporting exception for the OPHP medical director, improvement of information sharing from the state medical board to OPHP, and information on how other states handle the licensing of applicants who have had treatment with a PHP from another state. With regard to the question of the reporting exception for the OPHP medical director, 4731.251D4 already indicates that OPHP should not disclose any information to the board regarding a practitioner unless the practitioner represents an imminent danger to the public or to the practitioner as a result of the impairment. So it seems like that language that OPHP is looking for, in fact, already exists. But I also appreciate their desire for clarity in this regard because, we want to make sure that we maintain a level of trust in the relationship. So that discussion is ongoing, and maybe a memo of understanding would be productive in terms of clarifying that matter. Also, staff is currently working with OPHP to determine what information can be shared legally with OPHP. My understanding is that already we've agreed to share additional contact information of licensees, but we are still looking into whether we are able to share additional information of substance with OPHP. That additional substance would likely be helpful for OPHP in terms of the disposition of these licensees. But OPHP is not an F5 entity, so we can't just release records to them like we would to a law enforcement agency. So we're still researching this as well. Finally, one of the topics we touched on had to do with the eligibility for one bite regarding those who are initial applicants for training certificates or full licenses who have had treatment with a PHP in another state. You may recall that in Ohio, by statute, the one bite option is only available for Ohio practitioners. We're going to address this particular topic later in today's Compliance Committee meeting. Are there any questions? Okay, thanks everybody. That concludes my report. So next, Ms. Reardon will present the PAPC report.
Thank you, Dr. Schottenstein, members of the board. The Physician Assistant Policy Committee met on August 21st. We introduced the new External Affairs staff, and Chelsea Wansky, our new legislative director, did a legislative update. We welcomed Dr. Feibel as a member of the committee. Kim Anderson, our chief legal counsel, did a rules update. And the next meeting of that council or committee is scheduled for October 9th. And then as well, Dr. Cacarala asked me to do the Respiratory Care Advisory Council report. And the Respiratory Care Advisory Council met yesterday. Chelsea Wansky gave a legislative update. The council was informed that there were administrative rules that our chief legal counsel has talked about previously that will become effective on September 30th. That amend the education verification form process, and the form was given to the council for comment. The council was also informed that there will be a public hearing on September 24th regarding Ohio Respiratory Care Law Professional Ethics course criteria. The council was provided geographic maps of the number of RCPs and L1s in the counties across Ohio over a several-year period for comparison. The Ohio Society for Respiratory Care gave a presentation on the concept of a newly created advanced practice respiratory therapist level. And the OSRC is working on legislation that they will provide a copy to us that we will get to the medical board when it's complete. Unless needed sooner, the next RCAC meeting is scheduled for December the 8th. And that concludes both of my reports.
Thank you so much, Ms. Reardon. And so next, I'll present the Sexual Misconduct Committee report from this morning's meeting. So at the Sexual Misconduct Committee meeting this morning, we reviewed draft language that would add an enforcement mechanism for improper disclosure of confidential investigatory information to the F5 statute and to 4731.99, which speaks to penalties. So under F5, proposed language is as follows. No person shall knowingly access, use or disclose the confidential investigatory information in a manner prohibited by law. And under 4731.99, the proposed language is as follows. Whoever violates 4731.22 F5 of the revised code is guilty of a misdemeanor of the first degree. We review the fact that it would not necessarily change our legal analysis as to disclosing information, but might change our risk analysis if we know there is an enforcement mechanism. Nate Smith spoke to how we could add the enforcement language to some of our correspondence where we would indicate that disclosing information could make one subject to penalty. With regard to the F5 matters that were discussed in a previous Sexual Misconduct Committee meeting, we're putting those on hold for now because we really did not come to a consensus, and it may be more worthwhile to revisit those other topics in the context of an overall discussion of board structure. On another matter, Tessie was kind enough to update us regarding the duty to report video. That was on hold for a bit during the pandemic, but is back on track. We are teaming up with the Department of Public Safety to produce this video, so we will be collaborating. And we will be including an interactive quiz that will occur throughout the video. Because of that interactive quiz, we can't place the video itself on our website or YouTube page, but we can provide links to it from those and other sources. We have recorded our first interview with the the sexual misconduct expert. We will also be using previous clips that we've recorded on sexual misconduct video that we've previously produced. We are contemplating survivor testimony as part of the video. In the near future, board members will be receiving draft scripts, which we may comment on. With regard to the sexual misconduct historical case review, 96% of the reviews have been completed, as well as 85% completion of all of the working group tasks altogether. Substantially, the tasks remaining are the legislative ones that we are currently working through. All of the cases have been assigned to external reviewers at this point. We expect 100% of the historical case review to be done before our next meeting. We also reviewed the Sexual Misconduct Committee protocol, or the Sexual Misconduct Protocol, I should say. That was originally created back in July 2019, and among other things had instituted a committee to review all closures. We are revising this protocol, which staff will bring the secretary and supervising member and then to the full board. The substantial change in the protocol is that Angie Canepa will be reviewing the closings instead of the committee, which will provide more consistency and give us the benefit of her expertise in these matters. We reviewed the fact that the change in the protocol is not specific to Ms. Canepa, but instead we will build it into the position of Deputy Director of Enforcement Investigations itself. So whoever has oversight of enforcement investigations going forward will need to have this skill as part of their job description. Any questions? Okay, that concludes my report. Thank you. Next, Dr. Sullivan will give the Policy Committee report, please.
Yes, thank you. We started with the rule review that we typically do, and on the full board, as you guys know, we had some PA and respiratory care rules that had no comments that we voted for adoption. There are going to be some more that come out in October. Some of the rules are at CSI now. There'll be a public hearing on September 24th on one respiratory care rule, which I believe is 4761-9-04. That rule was amended more than 50%, and as a result, requires public hearing. We then went on to the legislative update, and there were two suggestions to the legislative update, which was excellent, by the way. Kudos to Chelsea and Stephanie for spearheading that change. But the first suggestion from Mr. Giacalone was to add a link to each of the bills. And the second was from Ms. Montgomery to be more clear about our positions and stances and recommended stances on various bills. I've already connected with Chelsea about an hour ago to make those changes and a protocol forward for future reports. But for the sake of this report, we actually looked at 5 bills relatively closely during the meeting. One was Senate Bill 246, the Occupational Licensing Reciprocity Bill. The next was House Bill 203, the Mobile Dental Services Bill, and there's a section about pharmacists being able to order lab and diagnostic tests, and we're asking for some clarification on what the diagnostic tests are and what potential liabilities may fall back on the physician as a result. And so that's something Chelsea will follow up with for us. Then the next bill was House Bill 263. With the issue of the board listing of criminal offenses. Again, we asked for more information impact on how that would affect us longer term. House Bill 341 was about pharmacists being allowed to prescribe opioid addiction treatment, and House Bill 492 was a bill about rapid intubation, pink slipping, and offering procedural sedation for PAs to be able to do that and to change their verbiage from a supervisor role of a physician to a collaborative role. I mentioned my personal opinion on that one was to strongly oppose, and I think some other board members chimed in on the same issue. After that, we went into the Board of Pharmacy rules on vaccinations, and Nate provided us a report. There's a memo in the minutes for the policy committee, but there's basically 7 relevant changes that were important to know. But there are things like, importance of following standard of care. The pharmacist must review protocol annually with the physician. The protocols shall be renewed on a biannual basis. Things like that. And of course, the 7th rule change was about the addition of a COVID-19 immunization, which obviously is important. And it said a pharmacist may administer the following immunizations in accordance with 4721.41 of the revised code. And under this rule, any immunization approved by the US FDA and Drug Administration for the prevention of COVID-19 in accordance with limitations set forth in the section of the revised code. And so I just wanted to make that noted, highlighted for the sake of the report. The final agenda item was a MAC letter. That was a letter sent for policy committee, but there's essentially 3 cruxes of that letter. The first was, understanding basically what we're going to do with this letter is Stephanie and the board team are going to research the 3 main points, which I will tell you in a second what those are, and provide some recommendations to help us guide further discussion. And those 3 points, the first one was understanding mental and physical conditions for impairment. The second was regarding public disclosure of illness or diagnosis. And the third was outsourcing confidential monitoring program issues and items. And those are things that we're, like I said, going to research, provide some recommendations and guidance for, but we appreciate the spirit of that letter and that opportunity. That actually concludes my report, unless there's any other questions.
Okay, thank you so much, Dr. Swan. So next, I'll provide the report from this morning's Finance Committee meeting. So looking at our date for July 2020, revenue was $914,818. That's up from last month, but we are still substantially under our projected revenue due to the extension of the licensure renewal deadline. There are still a lot of people, as we heard from Stephanie earlier, who are waiting to renew, and we have started the process of sending out reminders to those licensees. We are about $1 million under our projected revenue for fiscal year 2020. We will hope to make this up in fiscal year 2021. Our cash balance is $4,828,279, which is still a good number for us. July is the first month of our fiscal year, and there's not a whole lot of either revenue or expenditure to report on at this time. We had $28,000 left over from what we had previously encumbered for the historical case review. We re-encumbered it for 2021. That should take us through the end of the historical case review. If you look at the fines, we received $4,000 in disciplinary fines and $82.17 in collections for the month of July. You may see in our packet a proposed budget request for fiscal year 22 and 23. This is an expansion budget, which proposes increased spending. It would include 6 additional positions, resulting in a personnel ceiling of 90.5 full-time employees. That would consist of 3 investigators, 1 enforcement attorney, and 1 victim advocate. Currently, the medical board carries a large cash balance, but in the past 5 years, our number of licensees has gone up by 37%, and the number of complaints has gone up by 50%, with no corresponding increase in staff. So especially given our substantial cash balance, it appears to be an appropriate time to increase our spending in a prudent way. The last time the medical board increased physician fees was 1999, and physician assistant fees have actually decreased in the last 5 years. The earliest that the board would need to consider licensee fee increases for this increased spending would be fiscal year 2025, but there may be additional operational savings that would forestall that. The current fiscal year 21 cash balance is approximately 5 months of operating costs, and it would be 6 months of operating costs if not for the delay in licensure renewal. Public spending philosophy at this time recommends a more conservative cash balance of 2 to 3 months of operating costs. The medical board wants to be responsive to the recommendations of the governor's working group, and we want to be responsive to the recommendations contained within the recent FSMB audit. This proposed budget is substantially consistent with these recommendations, and the increased spending should allow us to implement them in an efficient way. Finally, this proposed budget gives us the flexibility of hiring either a part-time or full-time medical director if the board is so inclined, and we will be able to hire an IT staff member to fill a vacancy as well. So even though we are not funded out of general revenue fund, we still need, appropriation from the legislature. And so we talked also this morning about making sure that we have good metrics to know whether we're getting essentially good value for these additional hires. For instance, the complaint backlog we would hope would diminish. And so we're also contemplating as a cost savings measure, moving some staff to home. It has been productive in some ways to have staff working from home. We may be able to move some staff to home ongoing and then maybe free up office space, which should then help us with cost savings. It would be ideal if we could, have all of our board offices on one floor. So any questions about anything I've brought up so far? So we did have a motion, and it was informal because it wasn't per se required. We had a motion that passed this morning in the Finance Committee to support the fiscal year 2022-2023 budget as proposed by staff and send it to the full board to recommend that support. So if you'd be so kind, may I please have a motion to support the fiscal year 2022-23 budget as proposed by staff and passed by Finance.
Second.
And Dr. Safran, thank you. Is there discussion? Okay. So roll call please then. Dr. Rothermel?
Yes.
Dr. Safran?
Yes.
Mr. Giacolone? Sorry, was that a?
Yes.
Yes, thank you so much. Dr. Sohn?
Yes.
Dr. Johnson? Was that a yes? Thank you so much. Dr. Caccarello?
Yes.
Mr. Vanagopoulos?
Yes.
Ms. Montgomery?
Yes.
Dr. Feingold?
Yes.
Dr. Bechtel?
Yes.
And myself, Michael Schottenstein, yes. Thank you so much. Next, Dr. Safran will give the licensure committee report, if you'd be so kind, sir.
Thank you, Dr. Schottenstein. First is Dr. Billings has applied for a medical license in Ohio. She has not practiced within the last 2 years. Dr. Billings has been extensively studying for her upcoming specialty board exam for ABIM certification scheduled in December 2020. Dr. Billings has been focused on becoming board certified prior to searching for a specific position with the goals of working in an ambulatory hospital setting. My motion is move to approve Dr. Billings' application for Ohio licensure contingent on her successfully obtaining ABMS, American Board of Internal Medicine certification within 12 months from the date of the mailing of the notice of opportunity for a hearing.
Thank you, Dr. Safran. Is there a motion?
So moved.
Dr. Bechtel, thank you. A second.
Second.
Dr. Rothermel, thank you so much. Is there a discussion? Discussion? No? Okay, thank you. Roll call, please. Dr. Rothermel?
Yes.
Michael, I think Dr. Carla has something to say.
Oh, forgive me. Go ahead.
Can you hear me?
Yes, thank you.
Okay, sorry. Dr. Safran, did she have board certification and it lapsed, or this is her initial attempt at certification? Do you know?
I don't know for sure.
Okay. Okay, I was just curious.
I don't remember, actually.
Dr. Safran,
Yes.
if I may, this person completed her residency, but unfortunately, due to the death of her husband unexpectedly, has been home for 3 years following her residency, getting things settled with her children, and so this is her first time to take the exam.
Sure. Understood. Thank you.
Thank you. Of course. Thank you so much. Any other discussion? Okay. Roll call, please. Dr. Rothermel?
Yes.
Dr. Safran?
Yes.
Mr. Giacolone?
Yes.
Dr. Sohn?
Yes.
Dr. Johnson?
Yes.
Dr. Caccarello? was a yes. Thank you. Mr. Ganadakis,
Yes.
Ms. Montgomery,
Yes.
Dr. Feibel,
Yes.
Dr. Bechtel,
Yes.
and myself, Michael Schottenstein, yes. Thank you.
Next is Kelly Struckenmiller has applied for restoration of her Ohio Respiratory Care Professional RCP license. She has not practiced within the last 5 years. However, she has passed the Therapist Multi-Choice TMC examination on June 10th, 2020, and the Clinical Simulation Exam CSE on July 28th, 2020, and holds current RRT registration. The motion is moved to approve her application for restoration of her Ohio license as presented.
Thank you, Dr. Safran. Is there a motion?
So moved.
Dr. Bechtel, thank you. A second?
Move.
Mr. Jackalone, thank you so much. Is there discussion? Thank you. A roll call, please vote. Dr. Rothermel,
Yes.
Dr. Safran,
Yes.
Mr. Jackalone,
Yes.
Dr. Sowen,
Yes.
Dr. Johnson,
Yes.
Dr. Kakarala. That was a yes. Mr. Ganadakis,
Yes.
Ms. Montgomery,
Yes.
Dr. Feibel,
Yes.
Dr. Bechtel,
Yes.
and myself, Michael Schottenstein, yes. Thank you.
Next is Dr. Leone has applied for a medical license in Ohio. He is requesting that his experience and training in Chile, combined with research fellowship and 12 months of training in the United States, be deemed equivalent to 24 months of graduate medical education through the second year level of graduate medical education. The motion is moved to grant graduate medical education equivalents as outlined in 4731.09A4B to be granted a license.
Thank you. Is there a motion?
So moved.
Dr. Rothermel, thank you. Is there a second? Dr.
Second.
Bechtel, thank you so much. Is there discussion? A roll call, please. Dr. Rothermel,
Yes.
Dr. Safran,
Yes.
Mr. Jackalone,
Yes.
Dr. Sowen,
Yes.
Dr. Johnson,
Yes.
Dr. Kakarala. Yes. Mr. Ganadakis,
Yes.
Ms. Montgomery,
Yes.
Dr. Feibel,
Yes.
Dr. Bechtel,
Yes.
and myself, Michael Schottenstein, yes. Thank you.
Next is Dr. Lurtz Burapa has applied for medical license in Ohio. He has requested a waiver of the USMLE 10-year rule. The motion is moved to approve the good cause exemption to the 10-year rule as outlined in OAC 4731-6-05C2 and accept the examination sequence to be granted a license.
Thank you. Is there a motion?
So moved.
Dr. Bechtel, is there a second?
Second.
Dr. Rothermel, thank you. Is there discussion? Roll call, please. Dr. Rothermel,
Yes.
Dr. Safran,
Yes.
Mr. Jackalone,
Yes.
Dr. Sowen,
Yes.
Dr. Johnson, Dr. Johnson. Hi, Dr. Johnson. Dr. Johnson, yes?
Yes.
Yes. Thank you so much. Dr. Kakarala,
Yes.
that's a yes. Thank you. Mr. Ganadakis,
Yes.
Ms. Montgomery,
Yes.
Dr. Feibel,
Yes.
Dr. Bechtel,
Yes.
and myself, Michael Schottenstein, yes. Thank you.
Next is Christina Lester has applied for a license to practice acupuncture in Ohio. She has not practiced within the last 5 years. However, she recently recertified with NCCAOM on May 26, 2020. The motion is moved to approve Ms. Lester's application for an Ohio license as presented.
Thank you. Is there a motion?
So moved.
Motion, Dr. Bechtel, and second? Dr. Rothermel, thank you. Is there discussion? Roll call, please. Dr. Rothermel,
Yes.
Dr. Safran,
Yes.
Dr. Jackalone,
Yes.
Dr. Sowen,
Yes.
Dr. Johnson,
Yes.
Dr. Kakarala. That's a yes. Mr. Ganadakis,
Yes.
Ms. Montgomery,
Yes.
Dr. Feibel,
Yes.
Dr. Bechtel,
Yes.
and myself, Michael Schottenstein. Yes, thank you.
Next is Miss Oraz has applied for restoration of her Ohio massage therapy. Motion is moved to approve her application for restoration of her Ohio license contingent on her passing of the MBLEX within 12 months from the date of mailing of the notice of opportunity for a hearing.
Thank you. Is there a motion?
So moved.
Dr. Rothermel, thank you. Is there a second?
Second.
Dr. Bechtel, thank you. Is there discussion? Okay, roll call, please. Dr. Rothermel,
Yes.
Dr. Safran,
Yes.
Mr. Giacolone,
Yes.
Dr. Soen, Dr. Kakarala. That's a yes. Mr. Ganadakis,
Yes.
Ms. Montgomery,
Yes.
Dr. Feibel,
Yes.
Dr. Bechtel,
Yes.
and myself, Michael Schottenstein. Yes, thank you.
Next is Dr. Syed has applied for a medical license in Ohio. She is requesting a waiver of the USMLE 10-year rule. The motion is moved to approve the good cause exemption to the 10-year rule as outlined in OAC 4731-6-05C2 and accept the examination sequence to be granted a license.
Thank you. Is there a motion?
So moved.
Dr. Rothermel and Dr. Bechtel, thank you. Is there discussion? Roll call, please. Dr. Rothermel,
Yes.
Dr. Safran,
Yes.
Mr. Giacolone,
Yes.
Dr. Soen,
Yes.
Dr. Johnson,
Yes.
Dr. Kakarala.
Yes.
Thank you. Mr. Ganadakis,
Yes.
Ms. Montgomery,
Yes.
Dr. Feibel,
Yes.
Dr. Bechtel,
Yes.
and myself, Michael Schottenstein. Yes, thank you.
Next is Dr. Schliewit has applied for medical license in Ohio. He is requesting that his experience and training in Syria combined with his clinical fellowships in the United States be deemed equivalent to 24 months of graduate medical education through the second-year level of graduate medical education. The motion is moved to grant the graduate medical education equivalents as outlined in 4731.09A4B to be granted a license.
Thank you. Is there a motion?
Move.
Mr. Giacolone, thank you. A second? Dr. Kakarala, thank you. Is there discussion? Roll call, please. Dr. Rothermel,
Yes.
Dr. Safran,
Yes.
Mr. Giacolone,
Yes.
Dr. Soen,
Yes.
Dr. Johnson,
Yes.
Dr. Kakarala. Is a yes. Thank you. Mr. Ganadakis,
Yes.
Ms. Montgomery,
Yes.
Dr. Feibel,
Yes.
Dr. Bechtel,
Yes.
and myself, Michael Schottenstein. Yes, thank you.
Next is Rebecca Shook has applied for Ohio Respiratory Professional RCP license. She has not practiced clinically as an RCP for more than 5 years. The motion is moved to approve her application for an Ohio license contingent on successful completion of the clinical simulation exam CSE within 12 months from the date of mailing of the notice of opportunity for a hearing.
Thank you. Is there a motion?
So moved.
Dr. Rothermel, and a second?
Second.
Thank you so much. Is there discussion? Roll call, please. Dr. Rothermel,
Yes.
Dr. Safran,
Yes.
Mr. Giacolone,
Yes.
Dr. Soen,
Yes.
Dr. Johnson, Dr. Johnson.
Yes.
Thank you. Dr. Kakarala.
Yes.
Yes, thank you. Mr. Ganadakis.
Mr. Ganadakis needed to step out of the meeting.
No worries. Ms. Montgomery,
Yes.
Dr. Feibel,
Yes.
Dr. Bechtel,
Yes.
and myself, Michael Schottenstein. Yes, thank you.
And last, but certainly not least, Cheyenne Turner has applied for a massage therapy license in Ohio. She has not practiced within the last 5 years. However, Ms. Turner passed the NBLEX on August the 15th, 2020. The motion is moved to approve her application for an Ohio license as presented.
Thank you. Is there a motion?
So moved.
Dr. Bechtel and Dr. Rothermel, thank you. Is there a discussion? Roll call, please. Dr. Rothermel?
Yes.
Dr. Safran?
Yes.
Mr. Giacalone?
Yes.
Dr. Sohn?
Yes.
Dr. Johnson?
Yes.
Dr. Cacarella? Yes. Ms. Montgomery?
Yes.
Dr. Feibel?
Yes.
Dr. Bechtel?
Yes.
And myself, Michael Schottenstein, yes. Thank you all so much. And thank you so much, Dr. Safran. That was great.
Completes our report. Thank you.
Thank you so much. Next, we'll have a presentation by Rebecca Marshall regarding resuming in-person evaluations, please.
Thank you, Dr. Schottenstein. Members of the board, as you'll recall, when the pandemic hit back in April, we came to you and asked for a temporary hold on sending people to in-person evaluations, based in large part because of the state's stay-at-home order at that time. Now that we're a little further down the road and that has been replaced by the Stay Safe Ohio order, which is more liberal, we would like to have your feedback and approval on resuming sending people to inpatient evaluations, because obviously if we order them to go and they don't go, those would come before you as being disciplinary for failing to submit, and we wanted to make sure you're on board with us resuming ordering people to evaluations before we actually start sending them. And we'll entertain any general questions you might have about that. Thank you.
Thank you. Mr. Giacalone.
Rebecca, how's availability? I mean, granted, we have the people to go, but are the resources are available? Because I've heard, there may be still a tightening on that too.
Yeah, resources are available, so we do not foresee any problems with that.
Okay, thank you.
Thank you. Further discussion? Okay. Rebecca, do you need a motion?
I don't know that we need a motion. I think as long as no one else objects, we'll assume that we're good to go forward.
Okay.
Thank you very much.
Yeah, thank you very kindly, Rebecca. Next on the agenda, please turn to the compliance section. Do I hear a motion to approve the compliance staff's reports of conferences for August 10th and 11th, 2020?
So moved, Dr. Johnson.
Dr. Johnson, thank you. And Dr. Cacarella, I think your hand is up. Thank you. Roll call, please. Dr. Rothermel?
Abstain.
Dr. Safran?
Abstain.
Mr. Giacalone?
Yes.
Dr. Sohn?
Yes.
Dr. Johnson?
Yes.
Dr. Cacarella? That's a yes. Ms. Montgomery?
Yes.
Dr. Feibel?
Yes.
Dr. Bechtel?
Abstain.
And myself, Michael Schottenstein, yes. Thank you. At this time, we will consider the probationary requests in today's agenda that have been prepared by the Standards Review and Compliance staff and distributed to board members. Before asking for a motion, does any board member wish to consider a probationary request separately? Okay. Do I hear a motion to approve the secretary and supervising members' recommendations for the probationary requests? Motion?
So moved, Dr. Johnson.
Dr. Johnson, thank you. And Dr. Cacarella's hand is up. Thank you. Roll call, please. Dr. Rothermel?
Abstain.
Dr. Safran?
Abstain.
Mr. Giacalone?
Yes.
Dr. Sohn?
Yes.
Dr. Johnson?
Yes.
Dr. Cacarella?
Yes.
Ms. Montgomery?
Yes.
Dr. Feibel?
Yes.
Dr. Bechtel?
Abstain.
And myself, Michael Schottenstein, yes. Thank you. That concludes the September 9th, 2020 meeting of the State Medical Board of Ohio. Do I hear a motion to adjourn?
So moved.
Second.
Dr. Safran? Dr. Bechtel, thank you so much. All in favor?
Aye.
Aye. Thank you. All opposed?
Well done.
Great job.
Oh,
Nice.
you're very
Thank you.
kind.
Great job.
You're very kind. The time is 2:06 p.m. The meeting is adjourned. So great to see you all. I really can't wait till I can see you all in person again. But in the meantime, I'll take what I can get. So we have another meeting, right?